More than 13 million women suffer from stress urinary incontinence. Stress urinary incontinence is a condition where the pelvic muscles and tissue have been weakened, causing the bladder and urethra to relax from their normal positions. As a result, sudden abdominal pressure from coughing, sneezing, laughing, or simple lifting can cause accidental loss of urine. What causes stress urinary incontinence? Muscles and tissues are often weakened by pregnancy and childbirth, muscle damage, obesity, menopause, hormone changes, and prior surgery. For women suffering from this condition, you are not alone. Women of all ages can experience stress urinary incontinence. In fact, it may be surprising to learn that 1 out of 3 women over age 45 suffer from stress urinary incontinence. But there is good news. You don't have to live with stress urinary incontinence. Today, many advances have been made to improve the lives of women living with stress urinary incontinence. The use of a mid-urethral support sling to restore the normal position of the urethra and prevent the unexpected and sudden loss of urine is changing women's lives. Listen as these women share their experience with stress urinary incontinence and how they found relief with this minimally invasive outpatient procedure.
My life before I had this procedure done was pretty busy, as is everybody's, with 3 children. But as a fairly young mother, I couldn't do the things that I wanted to do with my kids as far as running around with them. I remember one time we were in the backyard and my oldest son said, "Mommy, give me a piggyback ride, come on." And I was so afraid. I said, "Honey, Mommy can't," because, and I couldn't tell him why, but I knew that pressure and then running, I thought, you know what, I'll have to go inside and go to the bathroom, so it changed how I interacted with my family a lot. Even my husband, just doing the fun things we used to love to do together. We'd run together, or we'd bike together, we'd do a lot of things. And I was always afraid to do them. And I'm not that kind of person. I'm not afraid of challenges, but I was, because it was embarrassing. And I didn't want anybody to know that I had that problem. So, it really had a negative impact on my life to have to live with that situation at such a young age.
My kids sometimes would comment, we'd be walking along and Mom would stop, cross my legs quick and sneeze, and they would say, "Mom, what are you doing?" And I really thought it was sort of invisible to other people, that they wouldn't notice that, but clearly they were, and my kids started saying things to me about it.
It absolutely changed what I wore. I was so afraid to wear anything that was light colored. I wore blue jeans a lot of times because I knew that if there was any problem that would kind of camouflage it. So I didn't wear a lot of the summer outfits that I normally would have worn. And it did change my self-confidence. I've always been a fit person, I've always been active, and it just made me feel 20 years older. It made me feel like I couldn't do the things that I had once loved doing. I had to compensate for them all the time, and then make excuses to people why I couldn't do things.
I'm an avid runner, and I had noticed that it really was, changing the way I could run. I was having to take breaks. I couldn't run straight through on my workout. So it definitely was impacting my exercise routine, and jump roping and even lifting heavier weights. All of that had a big impact on it.
It was always on my mind, 24/7. I was constantly reminded of it. And it was a problem that wasn't going away. It was getting worse.
The incontinence did seem to get worse. I especially noticed it within a 6-month time frame where, a few months went by and all of a sudden it seemed worse than it was even, a few months earlier.
The type of urethral support sling your doctor chooses will affect certain aspects of the procedure. However, placement of a sling is minimally invasive and usually performed as an outpatient procedure in less than an hour. Local, regional, or general anesthesia can be used depending on what you and your doctor choose. In general, placing a sling involves the following steps. Small incisions are made in the vagina, the abdomen, or where the top of your thigh meets your pelvic area. A soft, pliable piece of mesh is inserted. The mesh is self-fixating, allowing your body tissue to grow into it and provide support. On the left, the pelvic floor muscles are weak and the urethra is no longer supported, allowing urine to escape. On the right, The placement of a sling supports the urethra and prevents urine leakage. Your incisions will be small and should heal quickly. You may be able to return home in just a few hours after the procedure is complete. For approximately 4 to 6 weeks, you should avoid sexual intercourse, heavy lifting, and exercise. Your doctor will provide you with additional information on how to care for yourself after surgery. Most patients are continent immediately following the procedure and can resume normal, non-strenuous activities, including returning to work within a few days. Speak to your physician about the success rates you may achieve, as well as the warnings and precautions before undergoing any sling procedure.
Instantly, my problem was solved. I got up, went to the bathroom, cured. I mean, it was amazing how quickly that works. But, you know, I had about 2-3 days of kind of downtime at home where my doctor said, just rest, don't do anything, don't lift anything, take it easy and let your body heal around this product so that it will work for you for the long haul.
Normal activities, again, the next day I was fine. I did wait 6 weeks to go back to exercising. I wanted to make sure that I wasn't going to be, harming anything.
I was cautioned not to lift heavy things or strain a lot, and so I was very conscious of not doing that. But in terms of mobility and getting around, I was able to really resume normal activities very, very quickly.
It was tempting pretty soon after the surgery to return to my normal activities, but my doctor really suggested I wait 6 weeks before any exercising. I would say probably 2 to 3 weeks after I felt like myself again. The soreness had all gone away, the incisions were healed, and I felt like nothing had ever happened except my problem had been cured. It's amazing how when you have something you take for granted and then you get that taken away and then you get it back, what a gift that is. And, just the simple things of exercising and not thinking twice about, I have to wear something special or, do anything different. I can throw on my I can throw on my running shorts. I don't have to wear underwear if I don't want to, that kind of thing. The convenience of it is just so amazing. You can't really even explain it to somebody who hasn't been there. I had the procedure done about 1.5 years ago. And since that time, I haven't had any problems whatsoever with leaking or even worrying about that issue anymore.
The results have been extremely positive, no leakage, and my life is back.
Today is the day. Speak with your physician and take the next step to restoring your continence, restoring your life, and finding relief.